Doctor, your entry into Lionism movement and any special significance?
Well, I have been doing service for quite a long period by conducting specialized health camps. As soon after my MCH neurosurgery, I finished, I had a passion for service and I started doing service in the villages, that is, service above and beyond the call of duty. That was my motto. With that in mind, I started doing service, but whenever I started doing service in various villages, that is taking super specialized healthcare advice to the doorstep of the villages. That was what my motto was. And I started doing it, and I was asked by everyone, "Are you in the Lions organization or the Rotary?" Then I thought, okay, this one particular organization we'll have to be adhered to, and that will we get more hands also for helping. So in that manner, I joined this great movement, the Lions Clubs International. It is the world's #1 non-governmental organization doing human service to the poor, which in fact prompted me to enter this great movement and do service to the needy above and beyond the call of duty.
Doctor, your experience as a lion initially concentration on service projects. Anything close to your heart? Could you just discuss anything regarding to us which would help us?
I had been going through this movement. I've been organizing various specialized neuro health camps in various villages of Tamil Nadu. As I told you, with the motto of super specialized healthcare advice at the doorstep of the villages or villagers. And also, I had been conducting a road safety program, which is a form of Be Careful prevention program for college students for the past 20 years. I believe that as a neurosurgeon, we are doing very good job. That is, we are actually managing head injury patients very well. But I have a feeling that we should go beyond the confines of the four walls into the community to spread the awareness and the consequences of a road traffic accident, especially to the younger generation, because the students, the college students especially, they might be rash in driving, and therefore they may not know the consequences if an accident occurs by not wearing a helmet. So and once they get a damage to the brain, they become a burden not only to themselves but to the family and to the society. So this, I thought I must spread the message, and in the form of Be Careful prevention program, I have been doing this. It means be careful when you walk, be careful when you ride any form of vehicle, for it is better to be careful 1,000 times than being killed once. And this consists of 4 phases. Phase 1, I in fact will be telling the students as a neurosurgeon what will be the consequences of head injury and what will be the course in the hospital. I tell them. The phase 2 will be a short movie will be there on the consequences of head injury will be shown to them. And phase 3, we will have 1 or 2 patients who have escaped the jaws of death. They come over and narrate their history of what happened to them after the head injury. And they'll also be giving a sort of advice as an example. And the 4th one is crutches and wheelchairs will be kept so that the students can experience how their life will be after the brain or a spine injury. And the last one will be a pledge. A pledge, that's a road safety pledge that all the students will be taking. This is in fact exactly a 1-hour program, and I have been doing it in various colleges for the past almost nearly 15 to 20 years. I've been doing it in various colleges, and in the last 8 years as the Associate Dean and the Vice Principal of SRM Medical College, every year almost around 6,000 to 7,000 students get admitted. And in the induction program, I see that all of them take a road safety pledge.
Doctor, we are proud that you are the first neurophysician and neurosurgeon in Asia, and in spite of this busy schedule in profession that motivated you to aspire for governorship and the next higher post of multiple chairman too?
That is a very interesting thing. It's like, when the going gets tough, the tough gets going. On saying my dedicated work, see, when I joined the Lions movement, I joined as a vice president of a club. Then I became the president of the club. Then I became the zone chairman in charge of a few clubs, a region chairman in charge of a few clubs, and subsequently became the vice governor and the district governor. It's saying on my dedicated work, the Lions of District 324A5 and presently called District 324K, and the multiple requested me, in fact, and supported me to go up the ladder to take up the governorship and chairmanship and to contribute my might to the administration and spread the awareness of the services by the Lions into the community and further enhance the services that this great movement is doing. The success of my tenure as a governor and multiple council chairperson of 4 southern states, which includes Tamil Nadu, Andhra Pradesh, Karnataka, Kerala, Goa, and Pondicherry. And it is just because of the total cooperation rendered by each and every Lion, not only of 324A5 district, but of all these multiples.
Doctor, as a governor, what was a milestone in your governorship which Lions still remember?
You see, the most interesting part of the Lions Clubs International is a post like a governor is given only for 1 year. And you have to have your own programs which you're putting for the service. And, that for that 1 year. And after 1 year, the next leader steps in. So that's the beauty of Lions Clubs International. So in that 1 year, that is around 2007, where I was the district governor, the services rendered to the community, I planned in such a way that it's like GKG 10. The one is the Mela, called the membership. See, you have more hands into the movement, you find more hands are there to serve the needy in the community. Like that, we brought in around 31 clubs. Then the value-based education to be given. So we trained the new leaders, and that is one of the major aspects what we did. A lot of training programs, leadership training programs and workshops have been done for the future leaders rather. And the third one is igniting young minds. In that, of course, we had the Quest program. That is it's like a moral studies, that is being taught to the students for a sort of a discipline, and values of life are being taught. And this, we trained the teachers, around 30 teachers we trained. During that one particular year, we conducted science exhibitions, dance competitions. So this is actually, to see that the both halves of the brain are getting stimulated. As I told you, the left half is for linear thinking, mathematics, calculation. The right half is for music, dance, then the sports and various other aspects. So all this is called igniting the young minds. That is the third program of mine. And the fourth one is Champions Against Blindness. 40,000 adults have been screened, 35,000 children have been screened for visual impairment, and 4.8 lakh cataract surgeries have been done in that one particular year. I'm very proud about that. And also, eye pair donations had been almost nearly 140 to 142, which had been done in that one particular year. The fifth one is Health is Wealth. We conducted around 175 health camps, and 40,000 people were in fact, about 25,000 benefited from these camps, and 40,000 people were fed in Thiruvannamalai by Orticancer from the district, and also various other projects Orticancer became under Health as Wealth, and that is the fifth program. And the sixth program is the Be Careful Prevention Program. Now this is a very, very important project. This is a pet project of mine. And I think I have already narrated to you earlier on the various components of the Be Careful. That is, be careful when you walk, be careful when you ride, be careful when you ride any form of vehicle, for it's better to be careful 1,000 times than being killed once. And I had gone around, what you can say, the colleges, and about 25,000 students, in fact, benefited. Almost around 10 to 12 colleges I covered in that one particular year. That is the year of 2007. The seventh is the HH Bonanza, that is a Help the Handicapped Bonanza, where we had a job fair. About 100 people had come, and quite a few number had been selected. And then we had a mega Swayamvaram function for the physically disabled, and many assembled, and in fact, some of them chose their partners, and that was also done by past district governor Kolainena Dhanabalan. And eighth program is the Green Millennium Drive. You find about 10,000 tree saplings have been planted. That is to reduce global warming. And that is just a little contribution. And the ninth is the Golden Neighborhood Outreach Program. That is spreading awareness in and around your street. We do keep keep our street clean. At the same time, we involve the residents of the streets at least once in 2 weeks to see that some amount of service is being done and togetherness is being brought about, because and also we spread the message what we Lions are doing to the needy in the society. And the 10th program is the Euphoria. When I say Euphoria, that means all cultural festivals have been celebrated, like Onam, Diwali, Ramadan, Christmas celebration, Pongal festival, everything is being celebrated. But these celebrations are not done only with the Lions and Lions family, but each time we see to it that orphans or destitutes or any one of the poor and the needy are being brought. Either they are being fed, they are being given clothes, or they are being given various other articles actually. So that is how we had celebrated. And this is a wonderful program, and it is still, everybody remembers this program, as I told you, the GKG 10 it is called. The Mud Mela is 1, 2 is Veda 2007, 3 is Igniting Young Minds, 4 is Champions Against Blindness, 5 is Health is Wealth, and 6 is Be Careful Prevention Program, 7 is HH Bonanza, Help the Handicapped Bonanza, and 8th is Green Millennium Drive, and 9th is a Golden Neighborhood Outreach Program, and 10th is a Euphoria. That's it. That is during the governorship of that 1 year. These are the programs I carried out.
Doctor, could you just tell us about your experience as a multiple council chairperson? How different was it from a governorship?
Yes, multiple council chairperson was a very good experience for me, because we had around 29 districts from 6 southern states of India. We had around 29 district governors, including me. And at that time, there were 2 important projects which were carried out. One was the Cool Mother Earth program, a program where all the 29 governors participated, and almost to the tune of 1:10, 1 line is to 10 tree saplings. We had around 7 lakh tree saplings planted all over the multiple, with a view to prevent global warming. And I did travel all the 4 states and actively participate in the service projects being carried out, and motivated not only the district governors, but also all the cabinet as well as the Lions of these particular districts. And the other very important, as I told you earlier, the Be Careful Prevention Program, in fact, I taught to these district governors. And the most important thing I told them was the Golden Hour Project. That is, you find after a head injury, at this particular site, the hospital will be somewhere here. From the site of accident to the hospital, no treatment is being rendered. So you can have a second accident because of a lack of oxygen to the brain, because of aspiration or vomiting. Therefore, earlier the better, rush to the hospital. So this becomes a golden hour. Immediately first aid has to be given. So this was highlighted to all the governors, and one governor called Rajan Daniel, Lion Rajan Daniel, in I think Trichur. He was, in fact, he saw that as he was going in the night after a meeting, suddenly he found a crowd on the roadside, and he stepped down and took this patient, and he saw there was an accident and the patient was lying on this road. Immediately, he rushed this patient to the hospital, and immediate first aid was given, and the patient came back to consciousness, and he improved, and this hit the news headlines in Kerala. And subsequently, many people don't come and actually render the help because they think they'll get caught entangled in the traffic accident, and tomorrow they will be questioned. Therefore, the then Director General of Police, the Jacob Punus, in fact, brought it out a rule that anybody at any time can in fact rush the patient to the hospital, but The person has to be questioned only in his house by the police personnel. So this was a very good thing I could do. So these are the two programs which I concentrated as a multiple council chairperson. One is the Cool Mother Earth program, and other is a continuance of my Be Careful prevention program in a larger scale.